using like a great interdisciplinary approach to medicine. You work with everybody on the team to try to come with like a good diagnosis for what the patient has or how you can help the patient. It's like a multifaceted approach, not a one person leading the way. It's very team-oriented.
Today, we're preparing people to enter a career where they're going to work consistently in teams.
They really put an interest in training physicians here, training doctors. So you really figure out quick and early here what your strengths and weaknesses are as a physician, and then they work with you to strengthen your weaknesses.
It does feel like everyone is working together, that we're all working towards the same thing, and you never have someone trying to undercut you, and instead everyone is trying to lift you up. They're all there for you.
One thing that I think is unique about our career development program here at VCU School of Medicine is the fact that it's integrated into the curriculum in all 4 years.
As you go through the curriculum, you find faculty members that have similar interests who kind of guide you down your career path.
We give a lot of career direction, not just at the last minute, but right from the beginning. Our advisors make themselves incredibly available.
I have half of my dean's phone numbers in my phone because they're available at any time if I have a crisis and I need them, or med school's hard and they're there for a good support system.
I feel like we have a number of career advising programs that really make our students well prepared despite the increasingly difficult nature of the process. VCU School of Medicine students still fare very well in the residency match process.
We provide the opportunity for research early on.
Professors and the faculty and the doctors are all very accessible, and I've been able to just shoot out a couple emails and get a lot of responses of people who are really excited to have me working with them.
It gets them closer with the faculty that are discovering and creating science.
We practice evidence-based medicine here, so the importance of clinical research and clinical trials have really been made like much more significant to me.
And that's really important because that provides people with scientific inquiry and understanding.
You read things in books, you see like diagrams and you see like models of it, but it doesn't do it justice. It's definitely transforming.
The International Intercity and Rural Preceptorship is a 4-year program designed for students with a commitment and interest in working with medically underserved communities.
The IGCRP program lets you work with the community around Richmond, people with really poor access to healthcare, and it gives you that unique experience as a student.
And we ask students to think deeply about the social determinants of health.
Those who see healthcare as a right or a social justice issue tend to connect with us.
My work abroad and also within the local Richmond community helped me understand everyone's human and deserves compassion and empathy, and it helped me become a better doctor.
Our Baldwin Award really recognizes the clinical learning environment. And it's a sign of the commitment of the institution to creating an environment where students are pushed and challenged, yet supported.
They let you carry your own patients, you're presenting your own patients. The physicians here, especially the residents as well, really let you have an input on the type of things you want to do.
Our learners have a fantastic array of clinical environments. There's not a clinical environment in which they can't practice here at VCU.
You have Children's, you have the main hospital, you have the West Hospital just in 1 block radius, and I believe that's critical to interprofessional care.
There is no medical center that has faculty like ours. And what's important to them are the patients that they serve and the learners that they're serving those patients with.
Richmond is a good mixing pot or a good blend of different socioeconomic statuses amongst the patient population here.
That's important because we're training doctors for tomorrow that get the full range of experience here.
A lot of the physicians here are very tuned in to what's going on at the governor's office or at the public health offices, and they tell us.
I ultimately want to end up practicing in Virginia, And so it's a big appeal for me to be in Richmond.
Everything is here. So at most, you'd have to take an Uber or Lyft somewhere. You're not driving 20 or 30 minutes to get somewhere.
VCU is not only a great place to study medicine, but a great place to be when you're done studying. Richmond has it all for you.
When you're working with an awesome, nice group of dedicated people, it doesn't feel like work anymore.
VCU is truly a community, family-based atmosphere. The professors know me by my first name. They don't know me by just my student ID number. And that'll translate directly to my medical school career as well, because I have to understand that patients just aren't someone who's on paper. They're a real person.
Our patients really enjoy the interactions with our medical students. They understand that when you have talented people looking over the shoulder of other talented people, good things happen and good care happens.
This is what everyone tells you, like you're gonna learn the most, you're gonna have the most fun, you're gonna meet some of the best people, best faculty, best, classmates. And you're gonna make, lifelong bonds, as cliche as it sounds, but it's true.